It's said that if you don't have your health, you don't have anything. When you visit a healthcare provider, it's crucial that you know you are getting the best care possible. For hospitals, clinics, medical practices, and the myriad of other healthcare providers, the only way they can improve their level of care is to actually know how they are performing. SPH Analytics helps these providers measure and understand how they are doing. Of course, SPH can only give reliable information if the data they collect is accurate. The collection and analytic process of information SPH employs is complex. They contact patients in a variety of ways, such as phone calls, emails, texts, and paper surveys to ask very specific questions about how things went during and after a procedure or visit. In fact, the CMS, Center for Medicare and Medicaid Services, generates thousands of unique forms for virtually every type of healthcare event, including urgent care, appointment availability, and everything in between. Those forms are the basis of what SPH uses to gather the information. The data is then run through the analytics system to rate each interaction and combine it with other mountains of information to give a better picture of the services provided. By 2016, SPH realized they had a problem that was not getting any better. They had implemented a COFAX solution that required the creation of customized templates to match every type of CMS form. With CMS changing forms regularly, the situation was becoming a nightmare. In short, they were spending as much time on template reconfiguration as they would by simply inputting the returned patient forms manually. From hiring 40 seasonal employees during the peak season of March to August, it was becoming increasingly resource-intensive to meet standards. And something had to give. DocsTech presented a solution that changed everything. Change for anyone is difficult, but when you push past the difficult to something better, it makes it all worth it. DocsTech helped SPH implement a new way of doing things. Transitioning from the combining COFAX setup to an ABBYY Flexicapture solution made all the difference. The Flexicapture solution, in combination with IBML image track scanners, immediately improved the reliability and accuracy of the scanned information. Relying on machine learning to dynamically adapt and capture the nuanced changes of the forms, Flexicapture needed far less manual configuration, which dropped thousands of templates to between 400 and 600 documents set up in Flexicapture. And manual inputting? The seasonal labor force was reduced to 20. With all of these improvements and efficiencies, the entire processing time was more than cut in half. At DocsTech, we may not wander around in hospital scrubs with stethoscopes hanging from our necks, but we do help organizations like SPH find better solutions. Just like your expectations when visiting the doctor, we are interested in giving the best care possible.